learning and working with to better, deliver our message. That message, whether it's externally to general population, whether it's to a political community, legislative community, whether it's internally to our members, the importance and the art of being able to deliver information in today's environment. Let me just say just a couple of quick things, if I may. One, I don't know if we have any other vice presidents on, but I do want to make sure that to Ray and any others I don't see at the moment. So if someone's there, I just don't see you. But that our executive board has just been doing an incredible job in what is nothing less than a historic and unique moment that we all find ourselves in. And the real bottom line is to make sure this IAFF continues to perform at a high level, to make sure our affiliate leadership are provided the tools and the resources and services that they're entitled to do the very difficult work that all of you that fill those roles are doing every single day on behalf of our membership. And so I really want to tip my hat to the executive board that's really made sure that we have stayed focused on our mission and continue to deliver not only high quality, but high quantity of services out to you. And I also want to do a shout out to our incredible staff. And for some of you who have heard me, I've chatted with you in a couple of other forums here, so it may be repetitious for you, but for others, I want to make sure you know how unbelievably proud I am of the IAFF staff in both countries. I guess I'll show my generation just a little bit. I've had senior staff over time talk about, can we do a little teleworking? Can we do some remote working? And it's like, no, you go to work. You show up for your shift, you go to work and you work. And I hate to admit it when I'm wrong, but I certainly was wrong in the context of the ability to work in this remote environment and to still perform at the very highest level. And that's what this IAFF staff of ours has done in literally every division and department all across this IAFF. In fact, we have been on our multiple week assistants and the assistants meeting with their directors and deputies, then the department and division management, if you will, leaders, meeting with our staff, and everybody just performing at an incredibly high level, not missing a beat. And the work's going out the door. As I said, it's going out at a very high quality. So for the challenges that we are facing, I'm just, again, so very proud of each and every one of them that's made sure that this IAFF continues to perform at a very high level. As far as today, I know you're going to be going over some political issues with Dave Lang. I know that he'll be explaining a number of the federal programs. In fact, we just got off a conference call with the legislative staff to discuss our next set of priorities, how we're going to approach the next stimulus bill, COVID-4, where our priorities going to land to make sure state and local government gets the revenues replaced that we know that our affiliates, you are going to need in this moment of an economic turndown. And so we'll make sure that I'm sure Dave will be discussing with you COVID-3, COVID-3 and a half, and
all right, so in the meantime, I think he's just logged out. He'll probably try to log back in a second. So in the meantime, I'll give you the rundown on what we are going to do today. We'll keep proceeding. If GP jumps back in, we'll put him back on. So today's discussion is going to focus on two important divisions we have at headquarters, and we're doing a great job on health and safety like we discussed last week in our call, but we're also moving on to what the COVID-19 economy is going to look like moving down the road. And with locals out there going to be battling for their pay and their benefits, and what can they do to supplement those cuts that they're going to be facing. So I'm going to start today by introducing Dave Lang. Boss, you back?
I am back. So
All right.
you almost got away from me. Sorry, but you're going to have to suffer for a few more minutes. No, I was just saying that Dave, you're just getting ready to introduce him, but I know we'll be going over all the various federal programs that are providing the resources and that'll be available to our affiliates, but they need to know, where, how, when, what, in order to secure the.
So we're having a little difficulty there connecting with the GP. We'll get back with it. We'll get back with him as soon as we get that worked out here. In the meantime, I am going to start moving. I don't want to keep you here all day, so I'm going to get moving here on the political side of things and bring in Dave Lang. He's the AGP for our Governmental Affairs Division, and he's going to provide you an update and talk to you about some of the great work that they're doing.
Thanks, Mark, and good afternoon, everybody, and thanks for what you're doing. Let me just start by telling you how hard the government affairs staff is working on all of our members' behalf on Capitol Hill. Even though Capitol Hill is teleworking a lot like you are and like we are, they're getting a lot of really good stuff accomplished, and they're working really hard. On the call today with us is Shannon Meisner. So if you guys try to stump the AGP and I don't know the answer, I'm going to ask Shannon to help out and get us that answer for you. But let me kind of walk through the legislation that has been passed federally. Congress has passed 3.5, was what we're calling, different packages for COVID. The very first one was the response, and it put together money for PPE, it put together some money for testing, for vaccines, some initial startup money, about $8.3 billion. COVID-2 was the Working Families First, which dealt with the kind of the beginning of what people were going to see as we, as a country, tried to slow the spread of corona and by shutting the economy down and what was going to happen to employees. COVID-3 was the stimulus package in which a lot of money, $2.3 trillion, was put in. A lot of money was put in to help continue the economy as it is now, to continue it going, but more importantly, to make sure that it was ready when the cities and towns across the country and the states opened up. There was something that there was there to open up to, and that real people were faced with real issues and they're hurting, as you know. We protect Main Street every day, and the folks on Main Street probably at the end of this week will see somewhere in the vicinity of about 23 to 25 million unemployed, which is a lot of unemployed people in this country. So let me start with the first thing that happened was, if there's a hurricane or a wildfire, a tornado that happens, and there's a disaster in your local community, which happens all too often. You guys know what happens. FEMA declares an emergency, you get an emergency declared by the federal government, and then your response is then reimbursable for those calls that you went on, the overtime, the work that you did, at a 75% rate. What happened in this case was the President of the United States invoked the Stafford Act. And the Stafford Act really gives him a broad sense of, and a broad use of being able to not have waiting periods, not have certain rules that he has to supply by. It lets him put into play more quickly things to help the American people. It's basically 50 states that they're declaring an emergency. So instead of a disaster, it's now a national emergency. But what that does is it opens up the disaster relief fund in the federal government, which had $40 billion in it. So that $40 billion now gets moved over so that Health and Human Services, specifically in FEMA, can now manage this incident. And it opens up the pathway for the municipalities, the folks that are responding to collect money that's and be reimbursed for 75% of that cost for COVID-related responses. Now, in the stimulus package that was passed, COVID-3, they put another 45 billion in it. So we have 95 billion total that is in this disaster relief fund that's gone over to FEMA to be able to manage this response. So the low-hanging fruit for you is you're facing this COVID economy. Now, when you check your inboxes, you'll see an email that has come into the affiliate leaders that actually rolls out the COVID economy toolkit. So I'd encourage you to go on it, take your time, look at it. It's going to grow and expand just like the coronavirus toolkit did. It's going to provide you the resources and how to take on the challenges you're going to face. Federal government is going to help you with some money, but it's going to take the best and brightest of you to figure out how to navigate your way through this financial situation we're all going to be in as the communities went off that financial cliff. So make sure you put in for the FEMA, make sure your departments, encourage your departments to track every COVID-related expense and make sure that they seek reimbursement for that with the FEMA, the Federal Emergency Management. There is a link for guidance as to how to do that if you need that on this document and this toolkit that's coming out. Second of all, in COVID-3, we were able to secure $100 million under AFG for PPE. Now that notice for funding opportunity came out, and the application period, as Elizabeth will go into in detail, closes on the 15th. Make sure that you're encouraging your departments to put in for that. I would encourage the state affiliates on this call, because of the competition to get personal protective equipment, to try to gather up quickly local fire departments and put in a regional way for a grant. That increases the amount of money you're going to get for the grant, but it also increases your competition, the competition level when you're now bidding, as opposed to 3,000 fire departments with $50,000 each trying to buy PPE. You push them all together, and if the maximum grant is $1 million, it gives you that buying power to be able to compete to try to get those N95 masks, gowns, face shields, or the things that you need to make sure that you can respond safely in this response that we're doing. There is other areas in grant funding that Elizabeth is going to talk about with respect to Homeland Security and port security and so forth. I want to talk to you about two other areas. One is the state funding, which we get a lot of questions about. Currently, right now, in the stimulus package, there was $150 billion set aside and sent down to the states based on population, with the minimum money being transferred of $1.2 billion to the states based on population. So smaller states like the one I'm from, New Hampshire, Vermont, got $1.2 billion, 1.25, I think it was. And then it ratcheted up there from populations. But baked into that was any city or county with more than 500,000 population were eligible. And that gave them 171 different territories that got money out of that 150 billion that went to the 50 states, District of Columbia, and the territories and the tribes. So how do you access that money? If you are one of the 171 that put in for it, you should immediately go to your either comptroller or your finance division in your city, ask them if they applied for it, ask them how much they got, and then ask them the process and the plan under which they're going to distribute that money. Get to the table, because there are areas for you in helping to not replace revenue, but to create and pay for programs that are related to COVID response for your communities out of that money. Two, the money that goes to the state. Governors, legislatures, depending on how your state's made up, will appoint either a committee, an oversight person that will be in charge of managing that money. It's incumbent upon the state leaders that are on this call that they go in and maximize the amount of money that comes down to the local communities or funds the programs that you care about at a statewide level with that money that comes in. On this toolkit, you will also be able to see the amount of money is broken down per state, as well as the amount of money that's been bucketed for the municipalities. The next thing I want to talk to you about is money that's available in CDC, Centers for Disease, which goes towards emergency response through the public health system. Look, one of the biggest challenges we have is making sure that states and municipalities know for a fact certain that our response to EMS is part of the public health system. And because it's part of the public health system, there is a pathway and an avenue for money for you folks to get that money but you first have to go to public health, which is something you're probably not used to going to. Too many times, and I was one of them at the very beginning of this process, who was challenging, saying, no, we're EMS, we're in the fire department, we're in the fire service. Well, no, you're part of the public health response. When they access 911, that's the beginning access of the public health system. So there's funding as well in that was applied, and it was put in COVID-3 in the stimulus package. The last thing is it's directed for municipalities and counties, municipalities over 1 million people and counties over 2 million. Now, the sole purpose of this is it was $450 billion with a B dollars given to the Treasury to use with the Federal Reserve. Now, the Federal Reserve has created an investment vehicle known as a special purpose vehicle, in which will buy up short-term debt for those populations of 1 million for a city, or populations of 1 million, or 2 million for a county. Now, those are your tax anticipation notes, your tax and revenue anticipation notes that may have a short term up to 24 months. They will come in for liquidity purposes to be able to give the community of that size more cash and more liquidity by buying back some of those bonds. So that's only an avenue if you're in that population. So with all of this money, there's a lot of money floating out there. With all of this money, state affiliates are going to play a big role in working with the governors to make sure that the money comes down to the local communities. And then two, in those areas currently that have had money passed, make sure that you understand who got the money and who's in charge of splitting it up, and then go talk to them. Now, the Working Families First, we got some questions on this. And the question basically is that's the piece of legislation that added 2 weeks of sick leave, so that everybody got an extra 2 weeks of sick leave that was COVID related, that had to be used by December 31st, and it had no value. So any of our folks that think, oh, wow, I got an extra 2 weeks and I can sell it for 70% at the end of the year, 75%, and it may or may not go on my pension, you can't do that. It has no value to it. Our fire and EMS, are they covered under that Working Families First? And the answer is yes. You are eligible for it. However, the municipality or the employer can invoke an exemption. And that is because of the work that you do, and because you're a critically essential employee, and they don't know, Congress did not know, and left it to a case-by-case basis. So those local communities, those local affiliates that have really strong relationships with their employers, you can try to access that extra 2 weeks of sick leave. But in the absence, if you have, and we're encouraging affiliates to do this, if you have a COVID-related response that causes a high-risk exposure, that the outcome is a 14-day quarantine period for our members, you should be encouraging your municipalities to put those members on administrative leave. That administrative leave is then paid for 100%. Benefits are included. There's no lost time. It does not come out of their personal leave banks, and it's refundable it can be put in as a COVID-related response, which could be refundable under FEMA at 75%. So with that, Mark, I think I've covered everything that you've asked me to cover for. We're in the process now of Shannon and her team are working very hard with the Congress to talk about what COVID-4 looks like, and to make some changes. There's a list of priorities. One of the things that would be really helpful for us, those of you that are on this call, those of you that are inclined to reach out to your member of Congress or your United States Senator, call Shannon, send Shannon an email, let her forward you our priorities so that you have the latest information that you can talk to them about. If you have a question or a concern, or talk to us first, and we'll help coordinate that. We need to be on the same page when it comes to lobbying the Congress. You folks have a lot of influence, especially with your own stories that you get to tell. The problem comes down is if a group of you go in to a legislator, to a Congress member of Congress or a senator who has a very powerful position, and you're pushing for one piece of legislation that's a priority to you personally, and that's other priorities that the international goes up to, we now got a mixed message. And so what we want to do is we want to do that coordinated response, because if we speak with one voice on these issues, we'll have a much better time of getting more of our priorities included, as opposed to putting members of Congress in a cherry pick situation in which they try to satisfy the individual that called them as opposed to the good of everybody. So work with our staff, talk to the folks here, talk to Shannon. Shannon will respond to you that day, the next morning, so that you'll understand. And above all, after you've spoken to them, feedback is very important to us. We need to know what they've told you, what they said they would do, because that helps us when we're working with their staff and them. So with that, Mark, I'll turn it over back to you. If you have any questions, I'll take them now if you want.
Yeah, I'd like to take this opportunity to open this up for anybody who's got any questions for Dave in regards to our political efforts and the monies that are out there. Going once, going twice.
Hey, Mark, it's Brian Holtzlander.
Hey, Brian, go ahead.
What's a good contact point and person to direct our boards and our political allies for follow-up on this?
It would be, if you want to email Shannon directly, it'd be smeisner, MEISSNER @IAFF.org. Also check the COVID economy website, see if there's anything on there that might have already passed.
All right, thank you, sir.
Mark, this is Alan from Local 43, Portland, Oregon. My question would be does the International believe that the CARES Act money can be used for our day-to-day operations? Are we considered, do we fall under those guidelines to replace our people? If you could just briefly go over that, please.
First of all, the money that we know on COVID-related response of that disaster relief money, that you can get reimbursed for. So that for every company that goes out on a COVID-related call, Alan, are you tracking COVID-related responses for your local?
Yes, we are, and we got 114 million because of our population was over it. So the city got an automatic 114 million. And they're telling us they don't think they can use it for our responses. And specifically non-COVID positive patients, even if we're treating them as COVID responses.
So what you're talking about out of the 150 billion, the CARES Act. Now the two parameters under the CARES Act that I know of, and we can give you, and Shannon's on here as well. So Shannon, let me just say this and then I'll be quiet and you can add to it if you want, because I know that you've done some more research on this and know this probably better than I. But one is it could not be a budgeted item before, I think it was March 27th, 2020. So if you've got a budgeted item that was passed and approved by your city council or your electorate, you can't use that money to replace that. Two, it cannot be used for direct revenue replacement. So it has to be COVID related for new areas. And Shannon, if you wouldn't mind just kind of filling in some of the stuff on fire response stuff on that CARES Act money.
Yeah, that's exactly right. So Alan, if your city is saying that these were activities you were going to carry out anyways and it was budgeted for, this is funding that's not going to be available at this time. We are working in the next COVID package to make sure that any state and local funding that is appropriated there has a broader availability to replace state and local budgets. But at this time, what I can do is send you the list of criteria that uses of this funding needs to meet, what's eligible with the current funding. But yeah, if you are just doing regular calls and the city is saying this, we were gonna do this anyway, that's probably not something that you can use the money for. Now, if you're serving extra overtime as a result of increased call volume, that's something this money can be used for. If your guys are out quarantined and you need to backfill those positions, that's something this money can be used for. If there's any way at all to link the call to COVID, that's something this money can be used for. But as a general rule, just budget replacement, no, you're out of luck.
Anything else, Mark?
Shannon, Mark, this is Ray. Back to Shannon. Shannon, can that money be used for, let's say, the department purchased PPE, gloves, masks, any of that? Can that money be used towards that to replace for COVID?
Yes, so long as the department was not planning to purchase that PPE already.
Mark?
Yeah, go ahead, Kyle.
Hi, Kyle Hauser, Stamford, Connecticut. My question is back to what Dave said about members going on sick leave for COVID-related calls and how we want to avoid that because we can get some FEMA reimbursement. Now, would that have to be a COVID exposure with a patient, or would that cover an exposure in the firehouse from a coworker? Is there any distinction there?
I would take the position that it was COVID-related working. Shannon, you're shaking your head. No, it's not covered?
Yeah, there's no, for the sick or emergency FMLA leave?
No.
I'm sorry, I misunderstood the question.
For FEMA reimbursement. So I guess the question is if a firefighter is working in the firehouse and they get COVID from another member and they can prove that there was an exposure, the member had it, they work side by side, and they're making that application. I would go from I would go a workers' comp route because that was in the course of their employment because it was a defined case of COVID. I'm talking about COVID exposure without testing positive for receiving corona or COVID, that you would put them on administrative leave. Because now you've got because here's the question you got to ask yourself, is in the event that COVID leads to some disability, corona leads to some, including like we've had 6 times already, the line of duty death. You need to have access to the pension benefits that are associated with that. And the only pathway that I know of, unless your state law is different, is the pathway is through the workers' comp arena to get it as a job-related injury or illness.
Okay. Yeah, I asked because we're fortunate to be in a good position with testing here, and we have done department-wide baseline testing, and we're retesting every 2 weeks. So it's really easy to track which employees have it. And of course, people are coming out of service with it, but the people that worked around them, a 24-hour shift, there's a high probability you were exposed. So that's what we're dealing with, is the members that were exposed to their coworkers, trying to figure out how to classify them. That's our situation.
Okay. The main goal is to get it in the right pathway. And in some cases, in Stamford, you have self-insured workers' comp, right?
Yes.
The city has chosen self-insured workers' comp. So there's a lot more latitude in the ability for the city in this environment to adopt that as a compensable claim, which sets you up in a better position.
Okay, thank you.
Anybody else?
Yeah.
Dan, Brian Holtzlander here again, Anne Arundel County, Maryland. Regarding designating responses as COVID, just some clarification on that. So like everyone's department, we're screening at dispatch, and then if someone's identified as a suspected case, we're going out and then burning through substantial amount of PPE, N95s, gowns, and so forth on those suspected COVID cases. However, we don't have access to any follow-up on if the person was actually COVID unless there's a exposure with that. Now, if they're identified as suspected and we're incurring additional resources on a call because of the suspected COVID, does that qualify
I would,
for reimbursement?
I would use the CDC guidelines as the foundation for putting in that reimbursable expense, saying that this is a person under investigation. Therefore, you've got to respond in this manner, which is different based on the 911 information. And then from there lay that out. It's better to put it in and have FEMA kick it out and deny you than not to put it in, because you have a chance to get that money reimbursed. With respect to the PPE associated with that, the problem we're going to have is supply chain. You guys it's no secret. You guys know that. We could run a whole 2-hour webinar about the failures of FEMA when it comes to being prepared, getting us the personal protective equipment, and then not running this as a commercial response, but running it as a humanitarian response. So it's important for you to keep track of all of that, to make sure the departments to keep track, because that's the low-hanging fruit for money to come in now into the operating budgets. Everybody knows how the operating budgets work. It's a general fund that everything's there. Even though your department has a budget, everything comes out of that general fund. Money left over in that general fund at the end of the year goes into the fund balances, right? Which is the next measurable that Jim Brinkley and his crew will be able to help you with, is measuring those fund balances, which is the cash or the liquidity to keep your community going while revenue gets straightened out or federal money comes in. Helpful? Okay. Anybody else?
Yeah, Dave, or to Shannon again, this is Ray. I know you're working on all these immediate issues that we have going before us. Is there any look down the road that for firefighters that say end up with a significant respiratory problem from COVID, and it'll be, down the road that they will be, could be put off on leave or whatever? Are we looking at any type of legislation for the future for these type of firefighters and paramedics?
Shannon, you want to talk about the federal?
Yeah, I appreciate the thought. The answer is yes, but what that looks like is a little bit uncertain at this point. Something that where we are starting right now is with line of duty deaths, right? So you have firefighters who get COVID-19 or complications from COVID-19 and die in the line of duty. We are working right now to make sure that they are covered by the PSOB program. Now, as you know, the PSOB program also has a disability component. We're trying to be creative with that and taking a look at that. However, from the federal perspective, it is a little bit harder to get exactly at what you are, I think, talking about right now. But we are certainly taking a look. And if you have feedback for us or ideas, please send them my way. The other thing I would say is that, as Dave mentioned, there is emergency FMLA and emergency sick leave that is available for firefighters. Yes, your town or your municipality can exempt you from that, but for those that it is available for, that is going to be around through the end of the year. It's possible Congress will expand that later. And we are looking also to get rid of that exemption. So it doesn't address your concerns specifically. We're trying to be creative here. So I'd love to continue to have this conversation with you offline later. And anyone who has feedback or ideas for us, please share. We're always looking for more.
All right, so let's take a walk a little bit down the workers' comp road.
Yeah.
Workers' comp is set up as a state issue.
Yeah.
So state affiliates should be looking at their workers' comp laws. There has been some states that have successfully put in play, either through executive order or legislatively, that Corona or COVID-19 would be a compensable claim with a presumption in the event that they got it. Well, as a presumption, and they said they would get it in the line of duty. Now, what is the catalytic event, the kind of the start off point for you? Very early on in this emergency, Shannon and her team went and aggressively got COVID-19 added to the Ryan White Act. Any person that you transport to the hospital that gets tested positive with COVID-19, the medical director should notify your municipality, your fire department, that you have now been exposed, which is now the connective tissue for you to lay, this is where the patient was that I got COVID. So they can't say you got it because you went on Friday to your kid's baseball field and you talked to another parent who got it. Because that's where you got to make that connective tissue for the workers' comp piece. But I would encourage state affiliates to look down that road. There is some legislation that's been passed. There again, Shannon's got a segment of her team that can help you in chasing down that legislation and make suggestions for passage.
Yeah, but that's the real difficulty, Ray, is that this is a state level issue for the most part. So while we're trying to be creative, I hate that we keep repeating ourselves, but you know, a lot of this has to be addressed on the state level.
Mark, anything else?
No, that's it. I'm going to go one more round of questions. Any last questions before I shift gears? President Sullivan, Illinois.
Yeah. Thank you, Mark. And Dave and Shannon, I apologize. I was actually on another call and you may have already addressed this. But Chuck from Illinois, I'm speaking on behalf of our state association. In the CARES Act, I believe there was money for state and local governments, although that was only for populations over 500,000. So, and I hate to be specific because we're talking generalities here, but in Illinois, that's the city of Chicago and 6 of 102 counties. So obviously that doesn't bode well in Illinois. I guess I was just curious from Shannon or Dave's perspective, what your true sense is through your networks on this next tranche going to state and local governments, in addition to the money that we're asking for both the AFG and SAFER grant. What is your true sense, the dollar amount, the ability for it to pass?
I'm going to turn it over to Shannon, who's got her finger closest to the pulse of this than I do. So Shannon, what do you think?
Yeah, I think there will be money for states and localities in COVID-4, CARES 2, whatever we're calling it, the next COVID package. How much money is in that package? I don't know. It will be somewhere between 150 billion and 750 billion. I know that's a wide range, but there's negotiations going on right now. There will be more money. What that looks like, the funding formula, as far as states and localities go, is a hot topic in Washington, D.C. You can imagine that every senator and every representative who represents a different size city has a different opinion on it. That is a conversation that's ongoing, and I don't have a good sense as to what that's going to look like at the end of the day. If I were a betting person, I would bet they find a way to expand it, but the parameters of that expansion, I don't feel confident getting into right now. What we're doing at the IAFF is we're asking for more money for states and localities to ensure that as many of our members as possible can be advantaged by that. So
that opens up kind of the next direction that I'd like to take this for you, Chuck, is that we do a really good job at focusing on how much things cost at the local community level, how much staffing we need, how much health insurance goes with that, how much pension goes with that, how much the bunker gear costs that they wear. We do a really good job at that. We need to really focus about our own municipalities, about how they fund government, where the money comes from, whether it comes from sales tax, income tax, property tax, whether there's state revenue sharing money, how that comes. We need to understand that at a much deeper level. So I would go under the assumption as a mid-sized to smaller community that you're probably not going to get money or get a lot. So what do? You need to understand how your government is funded, how your municipality runs on revenue. Understand that better than the folks that are driving the bus on this, so that when money comes, in the event that money comes to you, then you can have an educated discussion with the municipal leader about how that money should be delivered. And it goes to the underlying question. Remember, with the unemployment numbers that you're seeing, the folks that pay for government, pay for healthcare, pensions, and your salary and our salary, they're not going to be as sympathetic as they might have been in 2008 or 2005, 2004. So you have to recraft the discussion, which I know that Mark Triglio and his shop and Doug Stern will help you do. But the real question goes to those bean counters is, how do you expect us to adequately and safely protect the citizens in this community based on these funding discussions? And if you go from that premise, understanding the revenue picture, you know what the expense side is. You know what it takes to keep all the shifts working and all the stations open. But you got to know where the money's coming from. That way, if the federal government does come with money, that makes your job a little bit easier. But I think you should plan on mid-size and smaller communities that you may not get any. Is that helpful?
All right.
I mean, Doug and Shannon, I have a question. This is Sticky Altieri from Baltimore Firefighters Local 734. About 3 weeks ago, the administration brought in all of the union leaders. And one of the things that was threatened were, as in the fire department, were a possibility of layoffs, furloughs, or even possible company closures. So how can we utilize this money to make sure we stop any company closures? I don't want to lose any companies. So we did respond back and say we are against any of these options that you were giving us. And we're also in the middle of negotiations as well. So how can we utilize this money from the COVID stimulus packages to stop any of these options for my members here in Baltimore or across the country? Because I'm sure I'm not the only organization or municipality or local who's possibly been threatened with layoffs or closures or furloughs.
Dave.
Vicki, what I would recommend that you think about is areas in the city government that can use that money, that would free up that money to be used to maintain fire service protection. In the city of Baltimore, they have fund balances in the general fund, and they also have other fund balances that are associated with that. Understanding those fund balances, and Jim Brinkley's crew can help you do that pretty quickly. That's their rainy day money that they can use. Start with that, then have a discussion with them about legally in their self-insured, in some of their self-insured pools and some of their enterprise funds, and some of the money that they've got bucketed over, like the harbor, if they has a special fund that they run the harbor on, can that money be repurposed? Can the fund balances be repurposed to keep the government open in the short term? Using that types of money can go where you can use the money that came in for a special purpose, put it there, but then use that to replace it. You got to be creative, and you got to think strategically. Think about, you don't want to really, if you can help it, make a concession, close a company without getting some guarantee that at some point in time you're going to go back to status quo. Because if not, you're going to find yourself that you're going to negotiate against yourself, and you'll be going back like you're starting in 1980 again. And you don't want to do that, because it's going to be the revenue picture is going to be pretty bleak for a while. So you want to be really creative about that. This toolkit that's going up today, Dickie, can have some of those ideas. If you want to put a group of us to help you talk through some of that, we'd be more than happy to do that.
Thank you.
All right, on that note, I'm going to switch gears. I'm going to hang on afterwards in case anybody's got additional questions. I'm going to switch gears. I want to thank Dave and Shannon for their input and their work that they're doing for us on the political side of things. I want to introduce now Elizabeth Del Rey, is an assistant to the general president for hazmat training and grants. And is really here to discuss the grants that are available to you. Just I thought Dickie's question was an excellent segue into this topic, because you can use grants to offset some of your budget issues. Not all of them, but you can use it to help offset and have a plan moving forward. And I think that's another thing, is if you're local or your city's on a SAFER grant now, what to do as that SAFER grant is ending. So on that note, I'm going to kick it off to Elizabeth and have a discussion on grants.
Thanks, Mark. How are we doing on time?
It's all yours.
Okay. I'll keep everybody going here. All right. Well, let's talk about the grants that you're most familiar with, right? So we've got AFG, we've got SAFER, we've got fire prevention and safety, and obviously we've got an extra $100 million in supplemental funds for AFG. So where we stand right now, and I'm using fiscal year money when I talk about it's fiscal year 19 right now. This is the money that FEMA's pushing out the door. So some of your departments may have already applied for AFG. That was fiscal year 19 money. That application has opened. It's closed. We've got IAFF reviewers right now, amongst others in the fire service community. Those applications are under review. Fingers crossed that the awards will be coming out by June. Next application period open right now is SAFER. If you are applying to or planning to apply for these, please contact my office earlier rather than later. We will be happy to review your applications to make sure they are the most complete and competitive going in. There are certain factors we can't fix, like if you have a budget surplus and other things like that, but we want to make it very easy for reviewers to go, that's a top-notch application, score it very high, and get on to the next one, because they get to move through them much quicker. In order to do that, as a local president, please email that narrative to us at firegrants@iaff.org, firegrants@iaff.org. That comes to myself and a couple other reviewers, and we'll turn those comments around for you very quickly. So that's SAFER, ends on the 15th of May. Also opened, as open today, was the $100 million that Dave and Shannon Shop worked very, very tirelessly on to secure for additional PPE. So this is sort of a modified AFG. This is not about turnout gear. This pot of money is not about apparatus. This is about frontline body substance isolation type of PPE. So these are your N95s, P100s, gowns, things of that nature. You'll see the list there. That application just opened. It'll be open to the 15th. It's a shorter time frame, but it's also a little bit of a shorter, streamlined application. So take advantage of that. Also open right now is fire prevention and safety. Most of your departments, you may or not apply for this. It's a very small pot of money. It's only $35 million. This is also the pot of money that organizations like the IAFF, IFC, and others are eligible to apply for, and we usually do. So I've actually started those applications on behalf of the IAFF and our IAFF Foundation as of yesterday. You still have some matching funds with those. Unfortunately, they haven't shifted. SAFER, your matching funds, you're going to get 75% federal funding the first 2 years, followed by 35% on the third year. Your AFG still has some matching funds in it depending on the population that you're serving. So if you're serving less than 20,000, your match is 5%. It's usually a cash match. If you're serving more than 20,000, your match is 10%, again, cash match. So make sure you get those applications into us so we can review. They're the most complete and competitive going in. And then Dave mentioned some other things and repurposing money. So if you are not now currently involved with your local emergency management group, your state emergency management group, your state homeland security departments, there are committees that were established by law out of the 9/11 Act when all this money started flowing in to say, all right, hey, we're going to give money to the states, we're going to give money to the urban areas, but hey, you got to set up a committee. Those committees for years have been heavily weighted with the emergency management community. So frankly, this whole COVID deal going on right now is an industrial hygienist and a public health services like greatest thing ever and the most exciting thing, because they've been planning for something like this for so long. They should have a ton of money for it. We have been underrepresented on those committees at the state level, the local level, and the urban area security working groups that are required to decide how that money that comes in by law from the 9/11 Act to the states gets distributed down. Those committees are deciding how that's done. Someone from the fire department, from the local, has got to be involved in those committees to start, having some influence there. So your state homeland security dollars, your states have probably already applied for that. They're probably getting ready to wrap up their applications. They've got money from last year's award that they got. They got money from the previous award for that. That money is good for 3 years. So when Dave mentioned repurposing money, that money can be repurposed should they have come in under budget. We have a lot of states and locals now who actually will over budget to spend grant dollars because historically they come in under budget, just an economy of scale, or a project loses priorities along the way. And it's like, hey, we've got 50 million sitting here. What do you want to do with it? So take a look at that. Start at your local emergency managers and your SAA, which is your state administrative agency. That's where the money comes in. It's usually your state emergency management agency, like in Maryland, where I live, that's Maryland Emergency Management. Sometimes it's the state Homeland Security. If you're not sure, simply send me an email and I'll let you know. I'll send you the list that's on FEMA's site. Same with UASI dollars, the Urban Area Security Initiative dollars. Those may come into a big city, but the way that that city decides how they're going to spend the money in that metropolitan statistical area, they may, there's a committee there deciding to do this. There's 15 million sitting there. Port security. If you are near a major port, this is always one I find interesting. Our Baltimore port, like Washington, D.C. is actually part of the Baltimore port. I don't understand how the Coast Guard figures that out, but that's their deal. Port money, there's $100 million there. A lot of fire departments who are responsible to respond on the port, help provide, whatever assistance, can get training, can get, you want your fire boat, that's where you're getting your fire boats from. It's usually port security money, and other apparatus. Maintenance and sustainment is also allowable with all these grants. That was a big deal when I was at FEMA under the Obama administration. So keep those in mind. And then there's also, if you need smaller items, there's the Dennis Leary Foundation. They've got money set aside to give grants specifically for equipment and training. The Motorola Foundation, Firehouse Subs. For some of your smaller things, you may find local communities, particularly once everything gets settled down and we're all allowed out of our houses again. You may find the Boy Scouts, the Girl Scouts, some church group may want to help do a fundraiser for you. I know when I was in the field, that's where we got, a lot of cameras and infrared cameras and things like that. So, don't be shy. You think it's not a lot of money, but once you start juggling your budget and making sure, for like example, AFG and these others, the Leary Foundation, Motorola Foundation, they've got their priorities. They know what they want to fund. Well, if you've already budgeted to fund a high priority item, apply for that high priority item. When you get it, we'll help you shift some money around. Now, some would say that's called supplanting, which is not allowable, but we will help you be strategic in the way that you do that because people shift budgets all of the time. Don't be frightened of that. So with that, I'll be happy to take any questions. Mark, turn it over to you. I know that was kind of fast, but we're here for you. firegrants@IAFF.org. And if you want to email me directly, it's just edelre, EDELRE @IAFF.org. And we'll be happy to, get right back with you and make sure you need what you need or get what you need.
So Elizabeth, before I open up for questions, let's say we have a department and a union, they want to apply for a SAFER grant. What are some of the things they need to do before they apply for the grant so that they qualify, that their application's not dead on arrival? What are some of the qualifications they need to?
Yep. So good. I'm glad you brought that up. So FEMA is using a new system right now. It's called FEMA Go. If your department did not recently submit for AFG, which is on that new system, you've got to go find your administrative person, whoever's job it is, to be physically in that system, to go in and make sure they're registered in the system. It's a much more easier to use type of system. So you got to get registered in Go, FEMA Go. It's called FEMA Grant Outcomes. Part of that is making sure your SAM registration is up to date. Again, that's an administrative thing. And by the way, if you get bombarded, if you happen to be the point of contact for your department on that, and you're getting bombarded by a company that says, I'll update your SAM registration for you, you don't need to pay for that. I do that. I created the ones for the IAFF. I maintain them every year. I do it for the foundation. People will be happy to take your money, but you don't need to do that. So don't let that scare you off. If it says, well, you haven't updated your SAM registration, it could take 4 weeks. If you already have a SAM number, it's going to take you 2 days to do it. It'll take you 4 weeks if you don't have one. Most of you probably your department already has that. You're going to need budget information, call volume information. If you email me or you go on FEMA's website, there is a get ready checklist for all of these grants. We work hand in hand with FEMA on these grants. We set the priorities, help them set the priorities. We help them with what questions to ask on the applications. We help them when it comes to scoring the application. What's more important? You're going to get more bonus points, particularly under AFG, if you go regional. You take that regional approach, even like Dave was saying earlier on the 100 million in AFG that came, you get bonus points anytime you go regionally. You buy more. There's supposed to be an economy of scale. So look at those FEMA checklists, consider going regional, consider sending your stuff to us. But if you have not applied recently, you're going to have to do some hunting and gathering when it comes to the last 3 years of your budgets and the last many years of call volume that you have.
Good, thank you. And one other topic I wanted to hit on was, let's say a department has a SAFER grant now. What do they need to be thinking? Can the city get rid of it midway through? What's the plan for when they say, okay, well, at the end of the SAFER grant, we're just going to let those 12 firefighters go? What's some advice do you have for some of those locals that are going to be in that situation?
Yeah, we have a combination of those issues coming in right now. Number one, we've got challenges with departments not wanting to apply for SAFER because of the matching requirements and because, oh, it's 3 years, we can't commit for 3 years. Here's the reality when it comes to grants. No one's going to give you a grant if you don't apply for it. If you apply for it and you get it, you still don't have to accept it. So don't go in with the mindset of what if, what if, what if. So let's go in with the mindset where we want to apply and come up with a plan on how to save people or save jobs, I should say. When it comes to SAFER, once that department accepts the award, they are accepting and abiding by the terms, should be abiding by the terms and conditions of the award, which says, hey, no layoffs during this period of performance. Now we are getting phone calls where departments are threatening to lay people off. They're in the first year or second year of a SAFER award. What do? Well, here's the official line from FEMA. Official line from FEMA is you applied for, you accepted the award. You cannot lay off. If you lay anybody off, you're going to pay back the entire award, not just give us what's left over. You got to pay us back the entire award. Now, what they're not going to tell you and what FEMA is going to push back on is there is an economic hardship that if your department really had to apply for, which is, I believe, only happened 5 times in the history of SAFER, that departments have applied for a waiver to say, look, we just can't handle this, man. And they not only laid off, but they didn't have to pay the award back. So not an ideal situation, but you'll get some pushback from FEMA at first going, oh no, you said you were going to abide by these terms and conditions. If you get to the point also where you're losing staffing due to attrition, you can't maintain your staffing numbers. There is a waiver for that as well. So don't, if you had 200 people in your department at the time of award, you are expected to maintain those 200 people. Well, if you can't do that through the course of the award, there is an economic hardship waiver. If you can't come up with the matching funds, there's an economic hardship waiver. If you need to supplant, there's also an economic hardship waiver, but they're not handed out like candy. FEMA will investigate all of them. And if the fire department is saying, hey man, we just can't handle this anymore, blah, 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 blah. Meanwhile, the police department's hiring or they're giving raises, FEMA will know about that. They love doing their little Google searches and everything else. You got to be really careful, but you do need to plan to save these positions once you get the award. And how you do that could be everything from saving the positions after the period of performance through attrition. You could be looking at any kind of tax levies or things of that nature, uncertain what the future is going to bring. But the only thing I'll guarantee you is if you don't apply, you're not going to get an award.
All right, thank you. On that note, I'm going to open it up for questions. Anybody have questions on grants? Going once, going twice. All right, on that note, thank you, Elizabeth. I'm going to close out the grants portion. As usual, anytime anybody has any questions, you know how to get a hold of me. I am definitely not hard to find. So I want to thank Elizabeth. I want to thank Dave and Shannon for joining us today. I'm going to stay on for a couple more minutes as this ends, but if you get a chance, if you're thinking of it, think of some of the things you want to have discussed down the road. What can we bring you next week and in the weeks coming? I know there's some classes coming from the IAFF on some other things, but things that you'd like to see in a quick format such as this. We're a little bit longer than usual today, but for the most part, things that we can have a quick discussion on, things that you can take home and put into place right away. Send me your ideas, put them in the chat room, send me an email, mtreglio@iaff.org, and we'll start putting some stuff together. So on that note, I want to thank everybody for coming today. This has pretty much been the biggest one we've had so far, almost 70, a little over 70 at one point today. So this thing grows every week. So I appreciate everybody coming in. I'm going to hang out until the end in case anybody's got any special questions they want to ask. And I'm going to close with just reminding you that we are coming down into some tough economic times. Do not wait to get your local assistance. If you need help with a strategic plan, you need a municipal financial analysis, let's get you triaged now. Let's get you some resources moving in that direction now. I don't want it to be, you've heard me say it, I don't want it to be like how our locals act on election day. When Tuesday is election day and they call us on Friday before to get some help. We want to get as many locals as we can situated as soon as possible. So feel free to reach out, get your local president on board, get your DVP on board. Let's access these resources. Let's be proactive and get you moving in the right direction. So on that note, I want to say thank you to everybody, and we'll see you sometime next week.